Hello, welcome to my channel. I'm John Peters. I'm a therapist who has worked for over 25 years with thousands of patients. And I started this channel to share a variety of wellness techniques and information, and also answer questions that people commonly have about therapy and getting good therapy. So, in this video, I'm going to be talking about privacy because a common thing that people ask is, if I'm sharing sensitive information in my therapy sessions, how can I be assured that the privacy of the recordings that might be made with the notes taken by my therapist, for example, how can I be assured that those are kept private? Okay, so in this video, I'm going to be talking about concerns that people often voice about privacy of their information that is likely recorded by their therapist in therapy sessions. So, people sometimes ask me, how can I be assured that my employer isn't going to know about this, or my what type of information is shared with my insurance company that someone might be able to get a hold of. People might wonder whether the content of the substance of the conversation in the therapy session is recorded in a way that, like, random people processing the reimbursement requests to the insurance, if they're reading those conversations, which is a reasonable concern because the majority of people are coming to therapy about things that are very personal and sensitive, and the conversation in the therapy sessions is often going to include information that a lot of us probably wouldn't want random people reading, right? Especially without our express knowledge and permission, right? So let me tell you a little bit about how notes are recorded and then how this relates to privacy. And so you can better understand what you can expect and how to ask questions when needed so that you are assured that your privacy is being maintained. So, number one, it's helpful to know that in mental health treatment, the notes that are recorded for any particular service, let's say a 45-minute session that you're having in the outpatient setting, you have what's recorded as your medical record, and you have a separate associated recording, which is called a process recording. Okay? Now, a medical record is what is going to contain information that the insurance company needs as a minimum amount and type of data in order to process a reimbursement claim. And this is going to be true of employee assistance programs that contract with outside providers. There's a minimum amount of information in order to actually process a reimbursement request if there's a payer source other than you as a private pay client. Okay? So when a submission goes, let's say, to an insurance company, what they are required to have, of course, in addition to correct identifiers of who the patient is, who the recipient is of the service, and who the provider is, right? So there's that information. But in terms of the content of the actual service, the date of service is recorded, the type of service. So type might mean a 45-minute session, or a brief interview, or a psychiatric evaluation, or a 30-minute session, something like that. So the type of service, and that doesn't include the content of the service, like the conversation you have or the details you share, but just the type, okay? And the date of service, the type of service, and it's going to include a diagnosis code, because if it's an insurance claim, of course, as you likely know, insurance companies only reimburse for certain types of treatment for certain types of diagnoses, okay? So that means that if you go talk to someone and they say, okay, I diagnose you with generalized anxiety disorder, that diagnosis, both in spelled out generalized anxiety disorder and the code that's associated with that is going to be on the claim submission form, right? So the date of service, the type of service, and the diagnosis. If the provider doesn't include the diagnosis, the insurance is not going to reimburse because they will only reimburse for treatment that's associated with an approved diagnosis, right? So the medical record is going to include that information, which is the date of service, the type of service, and the diagnosis code. And typically, it will also include the billing information, which is the fee for that service and whether or not you paid. So, what your balance is on that fee. Okay. That is your medical record. So, if you were sitting at the insurance company and you were looking at what did they get associated with that thing I did with the therapist, that's the information that they get. They don't get anything beyond that. And also, for the most part, if you contact a provider or you contact, let's say they work for a clinic or a group practice or some entity, and you say, I want a copy of my medical record, it's likely that's what you will get. You'll get a summary of dates of service, type of service, diagnosis code, and the fee and the balance due. All right, that is it. Now, I mentioned earlier that there is an associated note to the medical record that we call a process recording. So if I do, let's say, an initial intake on a patient, and I'm going to write down in the medical record date of service, and the type of service is going to be psychiatric evaluation. And let's say that they meet the criteria for they're having trouble dealing with something that just happened in their life and they're anxious. So it's adjustment disorder with anxiety. And then I write the little, what's called an F code on there, which is F43.22. And then my fee for my intake appointment in my private practice is X number of dollars, and they paid zero, so there's a balance due. Okay, so that's the medical record. But the substance of what I observe and record in the session is going to be part of the process recording. So if I say, okay, patient was on time, dressed appropriately, relatively overall generally normal behavior, was alert and oriented ×4, had linear thought processes, thoughts were logical and sequential, patient exhibited some perseveration on recent life events, blah, blah, blah. So I have this, what's called the mental status exam. And then I say, patient recounted history of recent life events. And we discussed strengths and coping strategies and challenges. And we formulated a treatment plan, which is going to include mindfulness-based cognitive behavioral therapy with the goals of patient reporting that they are going to have a lower baseline anxiety on a scale of 1 to 10, and that they're going to have reduced frequency and severity of periods of perseveration on targets of triggers of anxiety and things like that. So all of that stuff. So basically what I observe, what I think about, the presentation of the client, the treatment goals, and the anything else. You know, client said that their dog died 4 months ago. I might write that in my note, right? All of that is part of the process recording, okay? It is not part of the medical record. They are two distinct but associated notes for a particular treatment event, all right? And so what that means is, again, if the insurance company gets the medical record for reimbursement, they're going to get the pared down summary that just has date of service and type of service, diagnosis code, and fee, right? That fuller process recording technically is the property of the therapist or the entity, if they're working for an agency or an entity or a hospital or clinic or something. And even you, if you, as the patient, request your medical record, you're likely to get that farmer type, but not the process recordings. All right. And part of the reason for this does have to do with privacy. So both in terms of like, as a therapist, I don't want to share sensitive information that the insurance company does not need to know, which is why we segregate it out into the process recording as separate from the medical record. But also, there's a concern in mental health treatment that I might write as the therapist something in my notes that pertains to how I am working with the case and trying to appropriately and ethically and competently provide services related, let's say, to the process and the treatment goals. I might write something in my process notes that I'm not writing with thinking that anybody is going to be the audience other than me, including the patient, right? And this is part of why we don't release the process recordings to the patient, because if I'm writing a note about, let's say, a session I had earlier today, I don't expect that note to then be read by the patient. I'm writing it basically to appropriately and ethically record the type of service and the process that I'm in providing the service of the treatment for the patient consistent with the treatment goals. But I'm not writing it as I want this patient to read it and then react to what I wrote there, right? If you think about it, that would be a whole next level of complicated process that providers would have to get into if the process recordings were made available to patients. And in fact, if you go read the HIPAA website that concerns the federal policies on privacy, and if you go look at, there are different state by state laws, and some states have laws that kind of trump HIPAA in some ways and provide a little extra, layer of privacy. But if you look at that, then what you're going to find is that there is additional concern about protection for that process recording so that you don't get into additional potentially complicated, potentially confounding and problematic issues with the patient or someone else reading that, right? There are instances where that gets released, but I will say in my history of 25 years of working with cases, and there have been cases where legal wrangling has been going on in different ways, and I've been an expert to the case where there are court hearings and things like that. Even in court, we therapists try to protect and not release process recordings. A judge can demand it. Attorneys through subpoenas can demand it. So there is not 100% protection, but in general, 99.9999% of the time, nobody gets to see a process recording except the therapist. If they have a clinical supervisor, that person may review it as appropriate, but the insurance company's not going to get it, and even you're not going to get it without going to a lot of effort to get access to that aspect of your record. Right. I would advise you go to the HIPAA site. I'll put a link to the federal HIPAA policy site. It's actually pretty informative. And I would also say that if you have very specific concerns about your records for some reason, you would not only want to be apprised of the federal policies via HIPAA, but you would also want to look at your state laws that pertain to privacy of mental health records, right? You could just Google that. Like for Indiana, you could Google Indiana mental health records, privacy policies and privacy laws. And so you want to be apprised if you have a special concern about that. Now, people sometimes ask, can I ask my therapist to just not write any notes? Not really, because as a provider, you have an ethical obligation to write appropriate notes to document what you are doing in a case. And that not only has to do with that pared down information with the medical record, but it does pertain to the process content. So as a therapist, I do need to make a note that that gives evidence that I am appropriately paying attention to, let's say, the mental status of the patient and what they are sharing that is relevant to why they're seeing me and the form of treatment that I'm providing and how that might relate to the treatment goals. Therapists do have an obligation to write that in a terse, concise, minimal style so that, because extra words just always means extra liability in lots of situations. So writing as little as possible, but enough that appropriately satisfies those needs to document what a therapist is doing, right? Now, one thing to be aware of is that most states have, and this is true of the federal policies too, that there are these requirements to retain those records for X amount of time. After X amount of time, we therapists often will purge those records so that we no longer have them. Therefore, they're not available to anyone for any reason at any time after they're purged. But that also reduces liability. So another thing that's happened a couple times that I've known about in the last 25 years, there have been times where records were kept in paper form. I mean, at the beginning of my career, I didn't have or use an electronic medical record system. So I actually wrote notes on paper, right? And they went into files, and the files went into a locked, secured location. I've known about a couple different places that actually burned. So, if to the extent those records were in paper form or the digital aspects of them got burned, then they're gone, right? But in general, they're retained for X amount of time, and then they're purged. Now, another thing that people sometimes ask is, can I just pay private pay, and will that give me an extra amount of privacy with what I'm doing? And the answer is yes, to the extent that that medical record part is not being shared with a payer source. So if you're not using your insurance, and some people elect to do this for this reason, right? Sometimes they're very sensitive issues that people just don't want out in the world. They want more control over it. And so they say, look, I could use my insurance. It will cover this, but I don't want to because I don't want anyone, even the insurance company, knowing my diagnosis code, right? This is true, for example, with people who are sensitive about transitioning, right? And where they see someone for gender dysphoria, and they don't want even the insurance company writing, that they saw someone and got diagnosed with gender dysphoria. So if you pay out of pocket, that note is still going to get written, but it's not going to be sent somewhere for reimbursement, right? Now, another thing to consider, and I've noticed this over the years, that you should have some extra concern if you have privacy concerns about your medical record and you're using an EAP, so an employee assistance program, because it has been my experience over the years that when EAP entities process their reimbursement, they typically will ask for some additional information that is often part of the process recording. For example, is this person having trouble in their work domain? Are they having trouble in their private life? Are they having any substance abuse issues? Are they having trouble, so they might ask some additional questions that normally we wouldn't give to like the insurance company, but they are a little more granular, and therefore they're over in the process recording side. So that, it is a reasonable question. If you're a patient and you're seeing a provider, and the provider is providing services that are going to get reimbursed through an EAP program, it is reasonable to ask what the provider is going to need to provide to the EAP to get reimbursement through that system. All right. So again, how could you control that? You can't change what the EAP is going to be requiring, but you could elect to private pay and not use the EAP. That would be one way to avoid having any of that additional information shared with the EAP. Now, the question on that usually comes up from people who say, I work for a company, I'm using the EAP for the service. I don't want my boss. So there's a particular person, like their manager directly above them. I don't want that person or my coworkers to know. I would say that it would be shocking to me if in processing the EAP reimbursement that somehow they shared that information with your manager. But again, If you want to be in 100% control over that, then don't use your EAP for that reason if the information is too sensitive and you want to control it in that way. Again, you could ask the questions to the EAP people in terms of what they require for reimbursement. You could ask the provider about that so that you're really fully informed about that, okay? Then another thing that comes up is, and I'm going to make another video about minors accessing services and special concerns with that, but I will say in terms of the privacy, after you are like 12 years old in most states and via the HIPAA laws, you actually start to enjoy some rights of privacy yourself. So it's not the case that, like, if I'm a parent and I have a minor child who's, let's say, 14, and the child is getting services, because I'm the parent, it doesn't necessarily mean I have 100% access to their medical record, right? And this is true in some ways about the medical record and also about the process recordings. So that's another thing to be apprised of. And it's also something that if you have a minor child who's in therapy, your therapist should be able to clearly and competently explain to you how privacy works in the service delivery of their services to your child, right? So feel free to ask whatever questions you have about that, because confidentiality and privacy actually pertain to services to a minor child as well. And there are instances where a conversation and content that's shared by a minor with a therapist is not accessible by the parent easily, right? Obviously, the medical record is. So as a parent, you can say, I want a copy of the medical record. And again, you're going to get dates of service, type of service, diagnosis code, and you're going to get the balance due for the fee, right? And medical records sometimes will have the most minimal reference to the treatment plan, but again, not a lot of substance and content related to what the therapist is perceiving, thinking about, and writing down related to that, because that's part of the process recording. So I hope that this helped. If you have questions about this stuff and comments, feel free to leave those in the comments below. If you like this content, then feel free to hit the like button. And if you like the channel, feel free to subscribe, and I'll see you in an upcoming video.